तेरा सामीप्य ही मेरी आशा, तेरा प्रेम ही मेरा सचय, हे मेरे ईश्वर। तेरा नाम ही मेरा आरोग्य है, हे मेरे ईश्वर। मुझ पर तेरी अनुकंपा ही मेरी निरोगता, इहलोक तथा परलोक दोनों में मेरी आपत सहायक है। तेरा नाम ही मेरा आरोग्य है, हे मेरे ईश्वर। वस्तुतः तू ही है सर्व प्रदाता, सर्वज्ञ एवं सर्वप्रज्ञ, हे मेरे ईश्वर, हे मेरे। नामोच्चारणे गुणकारी देवा, नामोच्चारणे गुणकारी,
नामोच्चारणे गुणकारी देवा, नामोच्चारणे गुणकारी।
निन्न स्मरणे ನನ್ನ ಚಿಕಿತ್ಸೆ,
गुणकारी
ನೀನು ಕೊಡುಗೈದೋರೆ ನೀನು ಸರ್ವಶ್ರುತ
ನೀನು ಕೊಡುಗೈದೋರೆ ನೀನು ಸರ್ವಶ್ರುತ
ನೀನೇ ಸರ್ವಜ್ಞ ಹೇ ದೇವಾ
ನೀನೇ ಸರ್ವಜ್ಞ ಹೇ ದೇವಾ
ನಾಮೋಚ್ಚಾರಣೆ ಗುಣಕಾರಿ ದೇವಾ
ನಾಮೋಚ್ಚಾರಣೆ ಗುಣಕಾರಿ
ನಾಮೋಚ್ಚಾರಣೆ ಗುಣಕಾರಿ ದೇವಾ
ನಾಮೋಚ್ಚಾರಣೆ ಗುಣಕಾರಿ
Thank you very much for the wonderful devotionals, and welcome to each one of you for this evening's webinar. And this is going to be an interactive webinar. We'll all have opportunity to ask questions, clarify our challenges through chat. So what I request is, when we are on mute, we can use the chat box and we can go on asking questions as the speaker shares her insights. So, on behalf of the Baha'i community of Bangalore, I extend a warm welcome to each one of you and thank you for joining us this evening. Friends, as we all know, every day we are receiving new insights, especially on COVID-19 and on pandemic. And one of the areas which is still neglected to a large extent is care of our eyesight. Because most of us, we believe the virus spreads through physical distancing and contact with a person, but many times unknowingly we touch our eyes or we neglect to take proper care of our eyesight. And as we all know, our eyes are one of the most important organs of our human body. So this evening we are really privileged and we are honored to have Dr. Samina Zamindar. And this program is also live on Zamindar Facebook. It is also live on YouTube channel. So I just realized some of you have logged in on YouTube. So welcome to all the participants who have logged in on YouTube. This is also getting streamed live on Facebook, and all those who were not able to join for whatever reason, they can still go to the Facebook of Zamindar and still access that. Now, what has happened is during COVID, most of us went into some kind of a panic mode, or we went into a precautionary mode, trying to get ourselves tested only for that which is very essential. And in this process, we kind of neglected the care of eyesight. And with the change in the lifestyle and work from home becoming the new normal, there is more stress on everybody's eye, because each one of us, we are connected through one or the other device, or we are always on some kind of social media platform. Even children, to a great extent, use the digital platform compared to maybe 2 years back. But what we haven't realized is the trade-off between the convenience and the impact on the cataract or on our eyesight itself. While this is happening, what we have realized is there are many individuals, especially the healthcare professionals, who have shown extreme resilience, who have shown courage, and who have been in forefront trying to do all that to support the mankind with either the medical remedy or with the social remedy. So amongst us, we are privileged to have somebody who has been extremely passionate about the work that she is doing, Dr. Samina Zamindar, and it's my honor to briefly introduce her. Dr. Zamindar was awarded the Young Quality Achiever Award at the 4th International Conference of Consortium of Accredited Healthcare Organization at Chennai. She is also registered with the National Accreditation Board of Hospitals and Healthcare Organizations, which is considered one of the highest and most stringent healthcare requirement today in the country. She has been the chief instructor for training participants on implementation of NABH standards. And she has also started a knowledge sharing platform, Eye for Quality, to teach, learn, and share ideas and methodology of implementation of standards for accreditation since August 2016. What is also interesting to know that despite her hectic schedule and her commitment, every Thursday in the afternoon, she runs a free consultancy service for all those who are in need at her clinic. So anybody who wishes to get himself or herself tested, she very lovingly and her entire team is always supporting the needy. So it is very rare that somebody who is a constant learner, who interacts with patients of different magnitude, and parallelly also tries to apply the new learnings that she has through her work experience, and also able to integrate both technology and medicine to the treatment of cataract is something really very commendable. We thank Dr. Zamindar for joining us, and we request her to share her presentation. And I, on behalf of all of you, I now hand over the session to Dr. Samina Zamindar. And after she finishes her presentation, we will have an opportunity to interact with her. But in the meantime, please feel free to share your views or ask any clarifications that you have over the chat box so that we can raise this once her presentation is done. So Dr. Zamindar, over to you, please. Thank you.
Many sincere thanks, Mr. Dinesh Rao, for that kind introduction. I consider this as a unique honor to be invited by the Baha'i community of Bangalore to talk about something which is very close to my heart, eyes and the care of eyes. I have a special connect with the Baha'i community. My younger daughter was born on 12th of November. That, of course, is the birth date of Baha'u'llah. And when I talk about the pandemic and its effect on the eyes, let me also talk about how pandemic has affected many people in many different ways. The preachings of Baha'u'llah, love and kindness for all, is much more needed now than any time before. So thank you once again for inviting me to talk about how the pandemic has affected our eyes. Well, last year when the pandemic started, we could not hold hands anymore, but we decided to hold hearts and move ahead. Like any one of you, we healthcare professionals were also scared. But then, like some wise person in the late 18th century said that it is not our job to see what lies dimly at a distance, but it is for us to do what lies clearly at hand. And somewhere here, what in India we say that कार्य कठिन है इसीलिए करने योग्य है. कार्य कठिन है इसीलिए करने योग्य है. साधारण कार्य तो सभी करते हैं. So we pulled up our socks and we got this WASH certification, Workplace Assessment for Safety and Hygiene by Quality Council of India. We got all our protocols for COVID safety in place and decided that essential eye care services cannot be postponed indefinitely, pandemic or otherwise. And our services continued, and by the grace of God, we have not had a single case of transmission at our center. Well, this is the scope of my talk, and I hope that the next 1 hour, what you spend here with me today, is helpful to you, is helpful for you, for your family, is helpful to spread this word about preventing needless blindness. So I'll be talking about COVID-19 and eyes, computer vision syndrome, diabetes and eyes, and glaucoma and eyes. So let's come to the first portion of my talk today. That is how COVID-19 affects the eyes directly. This gentleman, Li Wanliang in China, was an ophthalmologist. He, if you remember, was the whistleblower for the pandemic. We lost him, but kudos to him that the awareness about the pandemic show us that conjunctivitis, symptoms just like any other conjunctivitis, you might be having redness, watering, a little swelling in the eye, could be the earliest sign of COVID-19. It might or might not be associated with any other symptoms. The cause, like Mr. Dinesh just said, is frequent hand-to-eye contact. Through the first and the second wave of pandemic, we are now wiser. We know that fomite-based transmission is rare. It is mainly an airborne disease. But nevertheless, frequent hand-to-eye contact can cause all kinds of infections, including COVID-19. So please be mindful of that and teach that to your children also. The retina of the eye, the most important structure of the eye, can get involved because of COVID-19. Because COVID-19 is a thromboembolic disease. It affects the clotting of the blood vessels. The smaller capillaries in the retina of the eye can get clotted, and you can have result in hemorrhages, vascular blockages. A picture of the retina becomes an important tool. This is a non-contact method in which a retina picture can be taken without even putting a single dilating drop, just with a click of a button. And you can see this patient had this papillophlebitis and optic nerve swelling as a result of COVID-19. Subtle changes can be picked up in the retina of your eyes with advanced scans, ocular coherence tomography. And this can, if once this is picked up, we know that we are going to be more aware and we are going to follow up this patient more often. Advanced retinal scans, the advantage is that the moment we see this kind of an edema or swelling in the retina, an injection is given, and you can see the next picture where this whole mountain has subsided and the swelling goes away. So this has to be detected well in time for the treatment to be effective. The other thing which COVID-19 brought along with it was mucormycosis, the black fungus. It's an acute opportunistic infection. Several fungi of the order Mucorales. This fungi is found in soil, air, skin, body orifice, decaying food matter. And the inoculation is by inhalation of the fungal spores. We inhale these fungal spores all the time. So then why it became a big problem with COVID-19? These are the predisposing factors. COVID impairs the normal immune response. The treatment of COVID includes corticosteroids, immune modulators, and there is a poor metabolic control, self-medication with steroids and antibiotics, and long-term hospitalization. All these things makes the patient susceptible to develop this full-fledged fungal infection, mucormycosis. Uncontrolled diabetes, malnutrition, cancer, long-term use of antibiotics or immunosuppressant agents or ionizing radiation can make you susceptible for mucormycosis. Friends, it's important to keep this in mind. It is important that after you have recovered from COVID-19, you should keep tabs on your immunity. Eat healthy and stay away from any decaying food matter, soil, dust. There is speculation that there might be a third wave around the corner. Please keep this knowledge handy if COVID-19 unfortunately affects any of your friends or family. This is the pathogenesis. These fungal spores are inhaled, and due to poor immune response, they get inoculated. They spread from nasopharynx and oropharynx to the structures involving the orbit, the eyeball, and it can cause vascular occlusion and infarction. In the eye, the patient presents to us with chemosis, loss of eye movements, completely blurred vision, and we diagnose. We have to remember that the moment we suspect that there is a mucormycosis in a post-COVID patient, that is an emergency. We have to start working on war footing. It becomes extremely important for us to understand that if you suspect that it is mucormycosis, it is already an emergency. These are the preventive steps which I want you all to focus and understand, that these preventive steps are a must for patients to understand if they have had a COVID infection. Use of mask while gardening, working in the field or in dusty environments. Keep sugars under control. Do not self-medicate with antibiotic and steroids. The role of antibiotic and steroid is questionable now in the treatment of COVID. So please be mindful of that. Personal hygiene becomes very important. Betadine mouth gargles, saltwater gargles, steam inhalation, and keep in touch with your doctor. Report at the earliest sign of any such redness, swelling, cheek pain, or any black discharge from the nose. Remember, you might be a suspect for mucormycosis. This brings me to the second portion of my talk. We spoke about how COVID-19 directly affects the eyes, but indirectly, what happened in the pandemic? You started working from home? Yes. What else happened? Remote schooling made your child susceptible to what we call computer vision syndrome. So let's talk about this computer vision syndrome. This looks familiar? What are the symptoms of eye strain or asthenopia? Light sensitivity, eye pain, headaches, dry eyes, blurred or double vision, itching or burning eyes, eye twitching and squinting. Computer vision syndrome, also termed as digital eye strain, a physical eye discomfort felt by many individuals after 2 or more hours in front of digital screen, characterized by dry, irritable eyes, blurred vision, neck and back pain. This is typically what we call it as computer vision syndrome. So when we talk about digital screens, let us understand how digital screens affect our eyes. Did you know what comes out of your mobile phone, friends? Radio frequency waves are ionizing radiations that are absorbed by the body part that is closest to the mobile phone or laptop. They damage the DNA of body cells and can cause cancers in the long run. Can you believe this? We are not just talking about eyes now. It's about the radio frequency waves even causing cancers in the long run. So please be mindful of it. Did you know that blue light came out of your digital screens, and the combined effect of blue light and radio frequency waves can damage the ocular surface, cause dry eyes, can cause cataracts, and cause retinal damage also. So please be mindful. Turn off the phone or turn to airplane mode while going to sleep. Don't keep the phone in your pockets, as radio frequency waves travel through clothes to your body. Radio frequency signals are the strongest when the phone or laptop is being connected to a power source to be charged. Never, never, never use the phone when it is being charged. Also remember that the effect of blue light is minimized by avoiding reading or watching screen in the dark. When everybody is sleeping and you want to now check your mobile, might not be really a good idea. There is something more to this. Digital screens even causes havoc with your sleep patterns. There is a melatonin hormone which has an association with sleep. So what does melatonin do? Blue light from these digital screens, they block the secretion of this hormone melatonin, and lack of melatonin disturbs our body clocks. It interferes with sleep, interferes with growth of children, make them agitated, restless individuals. It can interfere with their memory and learning also. Not just children, it can affect even adults. So remember that stay away from digital devices at least 2 hours before sleep time. So now we have spoken enough about the problem. Let's talk about the solution. I'm going to share with you 10 tips to avoid CVS, that's computer vision syndrome. The first and foremost is get a comprehensive eye exam by an ophthalmologist. It could be that there is something more than just a computer vision syndrome. There could be really a problem in your eyes. And what is that? Your eye examination might show that there is a cataract. You can see this yellowish, whitish area in the pupil center. That is what we detect on the slit lamp examination as cataract. A cataract is a clouding of the eye's natural lens. You can see how slowly this image is fading out as compared to the clear image. Most modern cataract procedures involve the use of a high-frequency ultrasound device that breaks up the cloudy lens into small pieces, which are then gently removed from the eye with suction. Short procedure is required for cataract surgery with no hospital admission. Why am I talking about cataracts now? Because many people are afraid of cataract surgery in the pandemic. They feel that they will get COVID infection if they go for a cataract surgery and then postpone indefinitely. Friends, I want to reassure each one of you that cataract surgery is a very simple and a short procedure. There is no hospitalization, and all COVID safety protocols are in place in all eye hospitals. Cataract, if it is left unattended, it can cause mature cataracts, complicated cataracts, glaucoma, and in elderly people, the blurred vision because of cataract can cause other tragedies like, a fall, which can even be more worst. So now there is this advanced optical biometry facility available, which is aimed at giving you spectacle-free vision after cataract surgery. The second part, after you've done an eye exam and there is no organic problem, you do not have any other problem in the eye, the checking of refractive correction becomes very important. Most of us might argue over here that, oh, but I can see everything clearly for distance. Friends, if you are going to work with digital devices for more than 6 hours in a day, a 0.25 number can also be significant. And that's why it becomes important for you to get a thorough refraction done and see that you wear those corrective glasses wherever required. The third important point is to minimize glare. Reduce the glare from walls and finished surfaces. Consider installing an anti-glare screen on your monitor, and if possible, paint bright white walls a darker color with a matte finish. Cover the windows. Adjust the lighting of your room. Avoid excessively bright light either from outdoor sunlight coming in through a window or from harsh interior lighting. Reduce the interior lighting by using fewer light bulbs or use lower intensity bulbs and tubes, and match the room lighting to the brightness of your devices. Overhead light, you can see this very clearly. It is a no-brainer that the recommended position of light should be behind you, not in front of you. Upgrade your display. I'm sure that most of us are now using LCD screens, and that is the best way because they have an anti-reflective surface. Adjust your computer display settings, the brightness, the text size, and contrast. Please pay attention to all of these things. There is something known as color temperature. Maybe your technical person can guide you about this. That blue light is a short wavelength visible light that is associated with more eye strain than longer wavelength used such as orange and red. And reducing the color temperature of your display lowers the amount of blue light emitted by a color display for better long-term viewing comfort. There are blue cut lenses also available in the market. You would want to try that. Please see that your working area, either for your child or for yourself, is dust free. We see a lot of eye allergies now because there is a lot of dust accumulated around and you're continuously working in that area. Blink, and then blink a little more. When you are actually staring at the computer monitor or a mobile, you sort of forget to blink. And remember, friends, with every blink, there is a recirculation of tears in your eyes. And we are constantly staring at the computer. Consciously remind yourself to blink more often. One more thing I would like to tell over here is that some people have a habit of splashing water inside their eyes in order to clean their eyes. Friends, please do not do that. We do not have any business to clean our eyes. There is a tear production, tear drainage. God has given a beautiful mechanism by which this happens. The moment you splash water in your eyes, the natural, normal tears get washed off. You definitely don't want that, right? Because then you're going to replace it with the tap water. Exercise your eyes. Look far away at an object for 10 to 15 seconds and then gaze at something up close for 10 to 15 seconds. Then look back at the distant object and do this 10 times, but early morning when you're fresh and your eyes are fresh. Remember to blink frequently while you're doing these exercises. And follow this golden rule. That's a 20-20-20 rule. Look away from your computer at least every 20 minutes and gaze at a distant object for at least 20 seconds. 20 minutes, every 20 minutes, gazing at a distant object for at least 20 seconds. If you can't do this, at least remember that every 40 minutes you need to take a 10 minutes break. Friends, I am very keen that at the end of a working day, when you go back home to your family and your children, you should not be an irritable person with headaches. You should be a relaxed person. How can you ensure that? Every 40 minutes, if you're taking a 10 minutes break, you're giving those small ciliary muscles of your eyes some rest. And that is so important. So take these breaks, just stand up, move about, stretch your arms, legs, back, neck, and shoulders to reduce the tension and the muscle fatigue. Ergonomics, this picture is self-explanatory. Just now, if you're sitting in front of a computer monitor, please check how are you sitting. This, people have ended up having spine surgeries because of this screwed up ergonomics. The last but the most important point is eat healthy, colored fruits and vegetables, nuts, avoid junk food, a lot of water. That's going to be very important if we are going to live in this new normal of the digital era post the pandemic. Myopia control program is something which is very important. Friends, we have to understand myopia or short-sightedness is becoming an epidemic in India also, which was first limited to countries like Singapore. Now, if you see, every other child is wearing a glass and it could be the child is short-sighted. So this is very, very important. You see, I have seen, I don't know about you, but I see small children being fed food. खाना नहीं खा रहा है इसीलिए मोबाइल में कुछ दिखा दिया. Would you want to do that? Really? Because it has been proved beyond reasonable doubt that digital exposure in early years of life can initiate myopia or short-sightedness. Please keep your child away from any digital devices till the age of 2 years, and after that also only maybe an hour if required. Books, hard copy books are good. Outdoor activities, good. Outdoor activities, sunlight, awesome, very good. Sunlight, exposure to sunlight has been proven to reduce the chances of short-sightedness or the progression of myopia. We at Zamindar's Eye Hospital are very focused about this epidemic on myopia. Every Friday between 3 to 6 p.m., we run a myopia progression control clinic, and suitable children are given this treatment in a form of a drop, which has to be put at bedtime. And this has helped reduce the progression of myopia. But even before that, if you can reduce the exposure to digital devices and encourage outdoor activity with good eating habits and good reading habits, that might be more important. We also have a vision therapy department because Sometimes, even despite the best of spectacles, both for children and adult, you might end up having eye strain, something which is related to your eye muscles. And there was a need for a vision therapy department in our part of the city, and we decided that we get into it and we provide this very value added service to our patients. So we have a dedicated vision therapy department which helps our children and adults to get over this computer vision syndrome, esthenopia, eye strain, double vision, lazy eyes, or amblyopia. Everything can be detected, analyzed, and then simple exercises given at the center and at home for vision therapy for the child or the adult. So these are simple vision therapy techniques available: the Marsden ball, heart charts, Brock strings, the stereoscope, walking rails, and there are vision therapy software where exercises are given. And after a few sessions, the child or the adult is empowered to do these exercises, continue doing these exercises at home. So this brings me to the third part of my talk today, that is diabetes and eye. Friends, India is a diabetic capital of the world. Early detection and treatment can prevent vision loss. Every diabetic has to visit the eye doctor once in a year. We are talking about diabetes and eye related to the pandemic affecting the eyes, because unfortunately last year's we lost a few eyes because of delay in treatment. Diabetic patients could not come to us for their regular eye checkups, and we did had to worry about this loss, because some important changes in the retina of the eye have to be picked up early, and a laser treatment has to be done for that in time. If that stage is missed, if the diabetic retinopathy becomes a proliferative diabetic retinopathy, then we are in trouble. Then the chances to regain vision is really difficult. Am I at a risk of suffering from diabetic retinopathy? If any of the below affects you, it's worth having a retinopathy screening examination as quickly as possible. Poor blood glucose control, protein in urine, high blood pressure, prolonged diabetes, and raised triglycerides in the blood. Preventing diabetic retinopathy: take a dilated examination once a year. Manage diabetes strictly through medicine, insulin, diet, and exercise. Test your blood sugar levels regularly and test urine for ketone levels regularly. Retina evaluation: most of my patients shy away from retina evaluation because they think that a dilatation and 2 hours pending and then the vision remains blurred. Friends, the central retina can be checked with this advanced fundus to do a dilated evaluation. Only if your ophthalmologist feels that a retina evaluation is required, then an indirect ophthalmoscopy is done, just like our Dr. Suma Krishnan is doing an indirect ophthalmoscopy here for a patient with diabetes. So this is what you see. Every picture shows us this. You can see there is this normal retina on one side and retina with vitreous hemorrhage and proliferative diabetic retinopathy on the other end. The treatment, if detected early, is very simple: laser photocoagulation and intravitreal injections later if there is swelling in the macular area or the central area of the retina. But all this treatment is useful only if the diagnosis is in time. Even before you develop such problems, if you're aware that diabetes can cause problems in the retina of the eye, you will be more mindful about taking care of your diabetes, taking care of your food, about your exercise, your mental relaxation. All these things is important for diabetic retinopathy. The last part of my talk is about glaucoma. And glaucoma is known as a silent thief of sight. Why glaucoma is known as a silent thief of sight? Because majority of the damage occurs while you can still see the central vision clearly. The glaucomatous damage starts from the peripheral field of vision. And you would have lost most of your peripheral field of vision, yet your central vision is crisp. So regular checkups become very, very important. So glaucoma causes progressive and irreversible damage to the optic nerve, which is the nerve of the eye responsible for vision, and which is, if untreated, can lead to blindness. There are different kinds of glaucoma, and your ophthalmologist will be able to check your eye pressures, do a thorough eye checkup, and tell you which is the type of glaucoma and advise you treatment accordingly. There might be signs and symptoms if you're lucky, but friends, remember that most of the time it is silent. There are no signs and symptoms at all. But if at all there are signs and symptoms, if you have an angle closure kind of glaucoma, you might have eye pain, headaches, rainbow colored halos around light, low vision, blurred vision, nausea and vomiting, or red eyes. But do not please wait for the signs and symptoms if you're above the age of 40 years, or even earlier if you have a family history of anybody having glaucoma in the family. Go to your ophthalmologist and get your eyes checked at the earliest. So this is what you see, the normal eye and the glaucomatous eye. The eye pressure is high in a glaucomatous eye, and that causes damage to the optic nerve. You can see this is a normal vision and then the vision seen by a glaucomatous patient. And this is how the progression happens from normal vision to early glaucoma to advanced glaucoma and to extreme glaucoma, where the vision becomes tunnel vision. And then as the last thing, the vision completely wipes out and leaves the patient completely blind. I would also like to share over here that to take care of patients who have advanced glaucoma, we have now started a low vision aid clinic at our center. Dr. Priya Timothy, our glaucoma specialist, heads the low vision aid clinic, and many patients have found relief with these low vision aids, even with glaucoma. So outsmarting glaucoma, how can you see that you should not develop? See, friends, you have to remember that once the diagnosis happens, the treatment is very simple. There is nothing to worry about or be scared about glaucoma. It is to worry is to delay your examination is to be worried, not the treatment or the diagnosis of glaucoma. Glaucoma is not going to take away your eyesight in a day. It takes maybe 3 or 4 decades of neglect in treatment of glaucoma that your eyesight will go. So all individuals above the age of 40 years, diabetic patients, anyone with a family history of glaucoma, high myopia, patient with high minus numbers, anyone who has used steroid, these patients should come for a regular checkup every year. We check the eye pressure and we also take a picture of the optic nerve, and we keep comparing it every year and seeing the earliest sign of any change in the optic nerve picture alerts us that this could be a starting of glaucoma, and we do a few more tests and then start the medication. The medication is just 1 drop a day. It's as simple as that. But that 1 drop a day has to be started at the right time. These are these non-contact tonometer for checking eye pressure. So nothing happens with touch. There is no COVID safety related problem at all. And treatment, like I said, there are drops, there is laser surgery in some angle closure kind of glaucoma, and there is some microsurgery if the glaucoma cannot be controlled just with drops. At ZMEC, we have treated many complex cases successfully, and we always urge you to get your eyes checked regularly. I would leave you now with sincere gratitude for staying with me, and I'm open to any question and answers.
Thank you so much, Dr. Samina Zamindar. It was extremely useful. You know, I don't have words to describe, but honestly, you know, the kind of insight that you shared and the information that you shared was extremely useful. Generally, you know, we all take our vision, our eyes for granted, and most of us, we feel that if we have power, maybe using a spectacle will, you know, take care of the poor eyesight. But honestly, what I realized, and I'm sure my other colleague participants would have also realized, that there is much more to that. And what was very interesting is that this can impact right from a small child to a youth, to somebody who is little elderly and senior as well. So at every age group, it is a responsibility of the individual and of the caregiver and the parent to ensure that we all get ourselves checked regularly, and whenever there is any kind of symptom or any kind of uneasiness, we should consult an able and an efficient ophthalmologist. So it was really amazing. And what is also amazing is this contactless tools that have been developed. in the field of medical sciences today. So as you described, if somebody is worried about his or her testing, you have now the necessary instruments and technology where you can test with lot of ease, and that comfort is also there. I personally felt that you should take these sessions more often so that it increases our awareness, and we come out of the ignorance that generally we have. But honestly, from bottom of the heart, I'm grateful that you managed to take time and shared with us. I think there are a few questions which have come on chat. So the first question is looks like from an IT professional. I'll just read this. I started feeling burning sensation in eyes while working on laptop, and also I get little bit headache. What is the steps I should initiate immediately? Also, is there any standard, or do you prescribe any level of brightness of the screen which I should set? So this is a question for you, and honestly, if you ask me, I think this must be bothering others also. So Dr. Samina, it will help if you can please advise.
Surely, yes. Um, what I would like to highlight over here is that if you are working with a digital screen for more than 4 hours a day, you will have burning sensation in the eyes. It's bound to happen. So please take breaks. Like I already spoke in this in my talk, that 2020 follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds, or every 40 minutes give yourself a 10 minutes break and walk around and blink and drink water, eat a salad, something very healthy, do all that kind of things whenever it's possible. You need to be alert about the fact that you cannot continuously abuse your eyes. Would you want to go to the gym and continuously work out for 6 hours? What you might just rubbish me and say, this is a no brainer. Yes, so what I'm talking for eyes is also a no brainer. There are small ciliary muscles in the eyes. You need to take break. That's very, very important. So please learn to do that. Do simple things. Blink more often, drink more water, take frequent breaks. You can, if you have burning sensation, you can get these tear supplement drops known as carboxymethyl cellulose, and please check the content correctly. There are simple tear supplement drops available. When you're buying a bottle from the pharmacy and when you open the bottle, please see that you use it within a month's time. Even if the expiry date says 2 years later, that doesn't mean that you can open the bottle and keep it in your medicine cabinet for 2 years, like how you do for other tablets. Eye drops, the shelf life is only 30 days after you open the bottle, because otherwise after 30 days it can get contaminated and add to eye infections if you use it later. So please be mindful of that. And about the brightness, I have already discussed in my talk. Please check with your computer hardware person, see what best you can get, see that you get the best. Now, whatever your settings in the computer, your color temperature is the most important. So you see that there should be more, the color temperature is less. So you need to take some professional advice to get your computer settings checked.
Thank you. Thank you very much. I think the second question is related to the regular assessment. So the question is that if somebody already has some kind of a medical ailment, maybe a BP or sugar or headache, is it still recommended to go for eye checkup? Because most of us at some point of time have given preference to the one which is irritating us most and is trying to disturb us most, rather than going for an eye checkup. So is there a trade-off? I think that's the question coming in.
Uh, there is no question of a trade-off. We have to understand that blood pressure and diabetes, high blood pressure and diabetes, it is a systemic disease, and eyeball are a part of your body. Just like how the blood pressure and diabetes can affect other parts of the body, it can affect your eyes
Okay.
and the retina of the eyes. These are known as the end organs, where the blood vessels break down into its minutest forms, the capillaries, the end organs, the liver, brain, heart, kidney, and the retina of the eye. And these end organs are the most valuable organs of our body. And once the damage occurs, it's impossible to get them back. So you have to be very careful. In fact, if you're diabetic or if you're having high blood pressure, you have to go for more frequent eye checkups to the eye doctor. And something more interesting than that is that I showed you in my talk that there is a retinal picture we take. So many times we diagnose the problem in the body by just looking at the retinal picture. The retinal picture is like a report card of your body. The way in which the blood vessels behave in the retina of your eyes, exactly in the same way it will behave in your kidney, brain, liver. We cannot open your kidney and brain and liver and see, but the retina is the only organ of the body where we can directly take a picture with a click of a button and see how the blood vessels are behaving. So please do not shy away from that visit. Thank you.
Yeah, the third question is from a youth, and I'll just read that. Yeah, give me a second, please. My eyes keep watering, so I rub my eyes very often. Is that the right thing to do? Please suggest what is the other alternative. So maybe this youth, when he or she is studying, there is a tendency to rub his or her eyes quite often. So is that right? If not, what is the alternative? This youth is asking us.
Thanks for asking that question. Rubbing the eyes is definitely not a good idea because your eyeball is a very delicate structure. The cornea of the eye can undergo a lot of wear and tear if you're continuously rubbing the eyes. So please keep away from rubbing the eyes. Moreover, like we already discussed, that when you rub your eyes, there is hand to eye contact and you can be taking all kinds of infection to your eyes. So please do not do that. Whenever you feel like rubbing your eyes, you can put some ice packs. That's the simplest thing you can do, some gel packs, and take a break from your work. If the rubbing continues, then you might want to go and meet an eye doctor. You might be having an allergic eye condition for which safe drops are given to you by an eye doctor, and you can and you can continue that. Remember that as a part of treatment of eye allergies, sometimes your eye doctor might give you a mild steroid drop, and this steroid drop might give you a lot of relief. But remember, you cannot continue the steroid drop for a long time. You should not, because that can cause major side effects like glaucoma and cataracts. So remember, whenever you are getting tempted to buy, you know, from a eye drop from the medical store, please see the content of it. Ideally, you should never do that. You might just get a tear supplement drop, but always check that you should not be putting a steroid drop without the advice of an eye doctor and should not continue beyond the advice of your eye doctor.
Thank you, doctor. The next question is, good evening, doctor. Me and my husband are facing blurred vision, light sensitivity due to COVID. Please suggest what is the action that we need to do. So this is a question which has just come on the chat, and I think both are facing blurred vision and light sensitivity due to COVID.
Okay. Some amount of blurred vision or light sensitivity could be because of dryness in the eyes, and tear supplement drops will help. But if it is consistent and if it is troubling you, I would definitely advise that a visit to your ophthalmologist might be a good idea to check whether if there is anything else going on, especially if you've just recently had COVID, if there is maybe a refractive error as simple as that, a glass number or anything else. In case if you do not recover in the next few days' time, then it might be a good idea to go and meet your eye doctor.
Okay. So the next question is, I need to wear my spectacles at all time throughout the day, including night. Please suggest some steps for me to be more healthier.
Some specs,
Steps, some
steps.
actions. Yeah,
Okay.
yeah.
Uh,
Because wearing a whole day throughout the day and including night, it can probably be a cause of discomfort. And maybe the student is asking this question that are there any steps for her to be more uh,
Um, this is, of course, a very generalized question. I don't know the age of the student, and so whether the child has myopia or hypermetropia. If it is a minus number, then, and if the child comes between the age of 4 years to 18 years, then there is something like myopia progression control program, what we do at our clinic, and that child can come and visit us, and we can assess the child and decide whether she or he is suitable for this myopia progression control, and we can start. That's one way which we can look at it. Another way, straight away, any healthy food, you have to remember that the eyes are a part of the body. Whatever is healthy and good for the body is good for your eyes. So please see that all colored fruits and vegetables, nuts, enough sunlight, and little less exposure to digital devices might be a good idea for you.
Sure, sure. Thank you, Doctor. Friends, we had these questions on the chat. We still have some more time. Anybody wants to ask any questions? Please feel free so that we can utilize this opportunity. And it's so wonderful to have Dr. Zamindar here. We can use her knowledge, her experience, and maybe also try to address the personal challenges that each one of us we are facing. I think we should use this opportunity. Yeah, there is one question which has come on chat. To prevent myopia in young children, is there any eye drop that can help prophylactic? So I'm not sure whether I'm pronouncing it right, but the question is to prevent myopia in young children, is there any eye drop that can help uh, prophylactic?
Yes, so prophylactically, there is no eye drop. Once, if you diagnose myopia, that there is short sightedness, and if it is progressing more than zero point 0.5 to zero point 0.7 diopters in a year, that is the time you decide to put this child on a myopia progression control treatment in the form of a drop, just one drop at bedtime, but not prophylactically. You cannot do it in advance to prevent myopia. Prophylactically, what you can do is to see that your child, when the child is young, learns good habits about and does not indulge in a lot of mobile or digital screens or video games, eats healthy, has enough share of sunlight and outdoor activities. So this is what you can do prophylactically. The drop will help only after the myopia starts, and if the myopia is progressing more than 0.5 to 0.75 diopters in a year, it is the ophthalmologist's prerogative to decide whether to put the child on the drop or not.
Sure, thank you. Is laser treatment recommended if you have specs and you are 18 years of age? So looks like this question is from youth. Is laser treatment recommended if you have specs and you are 18?
Laser treatment can be recommended to a person whose age is above 18 or 20 years of age, and the myopia or any number, short sightedness, has stopped progressing. There is no more progression of the number, and that's a good age to take care of the this kind of laser surgery, provided your cornea is thick enough, healthy enough for this surgery, and your retina, the peripheral retina, has to be examined, and if that is healthy, then yes, you're a suitable candidate. But for the first step to decide whether you are suitable for the laser or not, you have to visit the ophthalmologist. That's very important.
There's one question on this black fungus. That why is it so harmful and impactful, and is there a way to stop that? Because I think we haven't had many cases, but all those cases which got reported, it seemed very severe, and some of them even lost their eyesight. So, is there something around this black fungus? Because this seems to be very recent, and I'm not sure whether science has advanced enough to stop that.
So yes, thanks for that question. Actually, this fungus is there everywhere, like what I said, in the soil, in decaying food, and we do inhale this fungus. All of us, we do that, but we have enough a strong immunity. With COVID, what happened? The immunity got affected, and then there are different kind of theories about the zinc and other things, but definitely one thing is for sure, that your immunity got affected. You were on steroids, you were on immunomodulating drugs, and then this fungus which was taken care by your body's immunity now has a stronghold, and it once it starts working in your body and it starts dividing and growing in your body, it causes havoc. So that's why first and foremost you have to remember that your immunity should be very good after COVID. You should stay away, take rest, eat healthy, and see that your diabetes and all other diseases are in control. That's very, very important. And like what I said, the role of steroids is very limited in COVID infection. So, inadvertent steroid treatment should not be a good idea, especially now with the new knowledge about COVID. So if you take all these precautions, the chances of mucor will reduce. There is once it enters your body and shows the first sign. The first sign could be an eye infection. You know, the eyeball is swollen. There is restriction of eye movements. There is cheek pain. There is black discharge from the nose. Simple symptoms, and you have to be very alert. You cannot sit and neglect a single symptom after you have suffered COVID. You have to immediately take attention. Consider that as an emergency. Then only in case, worst case scenario, that yeah, that could be a mucor, you will be able to treat it.
So related to this, doctor, there's another question that it appears that for mucor, there are only selected few specialized centers which have the capacity to treat the patients. Is it true? And if
Yes, that's completely true.
oh,
That there are very few centers where they have proper oculoplasty surgeons, and this surgery is done in association with ENT doctors also, and it is a teamwork. It is not that ophthalmologists can treat that in a setup. No, it has to be a setup where it is a multidisciplinary setup where the ENT surgeon is also a part of the team, and then this job is done. So you are right. But the role of ophthalmologist is at least is to raise the suspicion and refer the patient in time.
okay, okay, sure, sure. So the next question is related to the contact lenses. So some of the younger generation, feel that it's a fad to use more of the contact lenses rather than wear the spectacles. Is it right, and will it harm in the long run? I think that's the question.
Let me be very honest over here. Contact lenses, if it is, they are worn with all the due care. If you know the discipline of wearing contact lenses, you're cleaning the contact lens case, you are changing the solution every day, you are seeing that you remove the contact lens when you go to sleep, and all this, and you have good hand hygiene, you wash your hands thoroughly before you wear contact lenses, remove the contact lenses as soon as you have some redness or foreign body sensation. And if you have this kind of a stringent discipline, then contact lenses are safe to use. But if not, then you should stay away from contact lenses. There are some professions where wearing spectacles becomes difficult, where contact lenses are definitely a very good choice. It's just that anybody who decides to start wearing contact lenses should have some discipline in their life. That's all about it.
Okay, the next question is that until few years back, we were not seeing many of the the spectacle showrooms in our colony. But last few years, we are seeing mushroom of these spectacle showrooms suddenly coming in. Is it that by nature people have become a little less challenged in terms of vision, or is it more of a corporate kind of a gimmick? I think that's the question which is coming here, because now you see that in every colony, you have different brands and you have different showrooms of spectacles for different ages, which was not there when I think we were young or maybe few years back. So the question is, what has changed suddenly that everybody seems to be opening, these showrooms, and everybody seems to be using that? Sorry, I think there's a deviation, but
No, that's okay.
yeah.
It's a very relevant question, and the reason we've already spoken about it. No, there is an epidemic of short-sightedness. Even children, there are many children who are now every other child is wearing a spectacle, right? So that is one thing. Adults, we are sitting in the Silicon City of India, right? Everybody works on the digital devices. Everybody needs preciseness in near vision, intermediate vision, distance vision. The kind of professions, occupations have changed now, have evolved over the period of decades. We are living in a different era altogether, in a digital era where eyes is used the most, right? So obviously, all eye related things you will see more. So that is, yeah. So it's all about a new normal which has happened now, because with everything in any business or any work, there is more work with the eyes. Previously, we were all very kind of hands on people, isn't it? Now it's more related to eyes. Our work revolves around the eyes.
Yes, true, true, very true, very true. I think the next question is, every time I wear contact lenses, I feel irritation even with the new contact lens. With using eye drop tear supplements, is it advisable? And if so, can they be used simultaneously? I think that's the question coming in, because somebody who already uses contact lenses, maybe there is an irritation, and once there is an irritation, so there is a tendency to use some kind of an eye drop or tear supplement. Is that okay or not okay, or what is your advice?
So that's a very good question. Thanks for asking that. There are two parts to this question. First part is that once you decide to start wearing contact lenses, a thorough eye examination is a must with an ophthalmologist, because it is possible that you already have dry eyes. You already have some problem in the eyes which is giving you dry eyes. That needs to be treated first. You could be having some mebominitis or lid margin blepharitis or any such problem which is giving you dry eyes, and that needs to be treated first. Once that is treated, then you are suitable for contact lenses. And with contact lenses, you will have to again see that the number of hours what you're wearing contact lenses is very important. If you're going to drag on for more than 6 hours, it is going to give you problems. So there are some tear supplement drops which are preservative free tear supplements. They can be safely used even with the contact lenses. So you should look for preservative free tear supplement drops and start using it along with your contact lenses.
Sure, sure. Thank you, doctor. The next question is related to sports. So while playing sport, I still need to wear my spectacle. Is it okay?
There are many players who actually do that.
Okay.
There's no harm to that, but of course, if you are contemplating to use contact lenses, that's also an option with you.
Right, right, right. Yeah, thanks. I think these were the questions which came on chat. So we have another maybe 5 to 10 minutes. Somebody on the forum would want to speak or ask or clarify or share maybe your perspective also. You're most welcome, so that we can all benefit from each other's knowledge and learning. Dr. Selvasekaran, Mr. Bhatia, Dr. I think Nishkanta. I am
Dr. Nishikant Shetty and Dr. Selvashekaran are also there with us today.
okay.
Happy to
Okay.
hear from them. Yeah.
Yes, yes, yes. So Dr. Nishikant Shetty, Dr. Selvasekaran, If you have any observations or any comments, you're welcome. uh, Dr. Bhatia from the Space Center, I think maybe there's a different experience there with the space scientists. So if you have any questions related to that, you please share it with us. Or if you have any experience how the space scientists are currently coping with this situation, most welcome. Professor Geeta, how is it that most of your students, how are they able to manage? Is there a challenge in terms of vision, or is there a challenge in terms of coping up of studies? Please, this is an opportunity. Dr. Sudhakaran, Mrs. Achama, I think if, since you work with a lot of youth and a lot of children in the rural areas, so if there is something that you have any challenges there, Dr. Sudhakaran or Mrs. Achama, please, you are most welcome, because we can all learn. I think through clarifications, through questions, we all gain from each other. Dr. Mehta, in case you find there are challenges, please do raise. I'm not able to uh, ask everybody, but please, all those who feel free, I think you should use this opportunity.
One thing which I would like to share here, Mr.
Yeah.
Dinesh, is that if you've had COVID infection in the either in the first or second wave, and whenever you visit any doctor, it's a good idea to share this. It's always, there's nothing to hide about it. It's no longer a kind of you should not be ashamed about it. You should always say, because there are certain diseases in different parts of the body which might be related to that, and you might, by sharing this information, you might be assisting your doctor to treat you better.
So this taking of vaccination is completely all right, right? Even if you have a challenge with your eyesight, or if there is a difficulty, you can still go ahead and take your first dose or second dose. Is that right? Is my understanding?
Yeah, so there is a time limit after which you should take your vaccine after you've recovered. Ideally, at least 60 days you should avoid, because your natural immunity is already there, and that should not interfere with the acquired immunity of the vaccine. So stay away from the vaccine for 60 days and then definitely go ahead with that. Yeah.
Okay, okay. Sure, sure. So, friends, anybody else, or should we end it here? Will that be all right? Izzat, you have any questions? Because you work with very different set of volunteers who are constantly in the field. Is there any challenge that they face in terms of eyesight related issues? Okay, so I think we'll end this, but
Dinesh, you're on mute.
oh, I'm so sorry. I'm so sorry. We are coming to a close, and on behalf of the Baha'i community of Bangalore, and on behalf of all the participants who are on Zoom, who are on live on YouTube and live on Facebook, I express my sincere gratitude to Dr. Samina Zamindar for something which is extremely invaluable and extremely useful, and for the insights that she has shared, and for the challenges that she mentioned, and also the solutions for each of these challenges. What is very interesting is that with proper basic care by each one of us, in terms of our hygiene, in terms of our well-being, in terms of our healthy food habits, and in terms of proper breaks, in terms of exercises, and most importantly, in terms of discipline, we can all control, or at least prevent, whatever eyesight challenges that we have from further deteriorating. And also, it's our responsibility to ensure that whenever we have any of these challenges, we need to go to a trained ophthalmologist and get ourselves checked. So again, I thank you, and we look forward to have you again, because this is such an interesting topic. You actually made it, very, 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 very interesting. Otherwise, nobody knows that there is so much to the eye care and to the eyesight. And as somebody just mentioned in the chat box, thank you very much, dear Dr. Samina. I can't think of a more complete and comprehensive covering of this topic. Thank you once again. Yes, I think it was indeed very comprehensive, and we pray to Almighty that God gives you all the strength to continue doing what you are doing, to serve the humanity, and to expand further. We know you are opening your third center now, but we all wish that you open many more centers and become a source of inspiration for all the young medical professional as well. So thank you very much. Thank you. With this we end. Thank you.
Thank you, sir. Thank you so much.
Thank you.
It was my honor to be here. Truly humbled by your words, sir. Thank you so much.
Thank you.